Good morning and welcome to this community briefing on our ongoing pandemic response efforts. Today, providing interpretation is Margie Propp. Thank you, Margie, and thanks to everyone for joining us. Extreme risk. Those two words continue to describe our local situation, and our risk dial remains in red. The mask requirement went into effect Saturday, and I want to thank our community for masking up to help reduce the impact of the Omicron variant on our community and healthcare system. Along with the mask requirement, our situation continues to require an urgent community response. Here are the actions we should all be taking right now. Go out only to go to work or school, to buy food or get medical care or get tested or vaccinated. Get vaccinated and boosted now. Avoid crowded situations and don't attend big events like concerts or athletic events. Get tested if you have COVID-19 symptoms or have been exposed to someone who does. If you are sick, stay home and away from others. Now let's take a closer look at our local data. The number of new cases continues to increase rapidly. This chart shows new cases by week, and you can see the sharp increase since the beginning of the year. Over a 3-week period, the number of new cases increased from 982 the week ending December 25th to over 4,400 last week ending January 15th. This is an increase of more than 350%, and we have seen record high weekly case counts for the last 2 weeks. Now look at our hospitalizations. They have also increased since the beginning of the year. On this chart, you can see the average weekly hospitalizations have increased from 113 the week ending December 25th to 134 last week ending January 15th. As we shared on Friday, the risk dial metric for local hospitalizations has been in the severe risk or red category for 3 consecutive weeks now. These COVID-19 hospitalizations are devastating for patients, their families, and healthcare providers. Unfortunately, our experience has been that when we have a higher number of people hospitalized due to COVID-19, one of the results has been an increase in deaths. We are reporting 1 death so far today, a man in his 70s. And sadly, we have lost 21 members of our community to COVID-19 so far this year. Our local hospital administrators are here with us again to provide an update on the current situation as the number of COVID-19 patients needing hospital care continues to rise. Let's hear, starting with Russ Grunwald, President and CEO of Bryan Health, and then we'll hear from Derek Vance, President of CHI St. Elizabeth and Nebraska Heart. Russ?
Thank you, Director Lopez. Just a quick update on some of our numbers this morning. 98 COVID patients in-house, or in COVID protocols, averaging a little over 100 so far this week. 10 of those are in the ICU. We have a total census of 536, so at and exceeding capacity. Every ICU bed is full this morning. 10 inpatients bordering in our emergency room, and we'll be finding beds for them throughout the day today. A couple of thoughts about the current situation. Good news, and first of all, I'd just like to say thank you for all of you out there who are masking when you're going out. We see it when we're driving around. We can see it and sense it. That's an encouragement to us, and of course, that's great for the community. We're grateful for the fact that for many of you who have had COVID or that are getting COVID, the symptoms are mild. And for others of you, they're only severe for a few days and you're recovering. So we're thankful for that. Despite the fact that we have about 285 folks out plus with COVID, plus several more related to families that have COVID in their family, We are still being able to keep our place open at capacity due to extended hours and extended shifts that people are taking on. So we've been able to use all of our bed capacity, and we haven't had to sacrifice any critical services, and therefore even keeping some of the necessary surgeries going, being very careful with those that might require an ICU bed and not going that whenever possible. And finally, because of universal masking, we're thankful that our infection of our staff at work is nearly non-existent, that the masks really have been working well. I do want to clarify one thing that I'm hearing over and over, and I'm sure you have as well. In this case, yesterday, a friend of a friend posted something that said, Omicron is essentially just a little bit more than a cold. What's the big deal? And I'll just say that despite the fact that for many it is low severity, again, there are about 100 folks in my hospital that would disagree that it's just a little bit more than a cold. The folks in our hallway beds in the ER would disagree that it's a little more than a cold. And as was mentioned already, we've had a number of deaths this year. We've had, in the first 18 days at Bryan, we've had 20 deaths, so more than one per day. 6 of those under 55 years of age, and not necessarily with comorbidities and other complication. And in fact, 3 of those 6 were in their 30s or 40s. So essentially, again, 1 in their 30s or 40s dying every week. This is certainly more than a cold. Again, numerous people on waiting lists from other hospitals that can't get in. 3 pediatric COVID patients in our organization today, and Omaha, really, Children's Hospital full with patients. We are making arrangements to take more pediatric patients here in their because of their request for us to think about that. So to say in our community that this is anything other than a pandemic emergency would really be a misstatement. So I just want to make sure that was clarified from our perspective. What to do? Well, again, there's really no need to panic. There are great solutions for us out there. Get boosted. I talked to a pulmonologist last week who said that he had not seen any boosted patient with Omicron in our ICU yet. I don't know if that's continued this week, but the point is that the boosted patients really are not having the severity of the disease. And then, of course, mask. Even consider double masking. We're finding with Omicron, all the studies that are coming out, just last week some new studies came out. Masking does work for Omicron, but you got to seal the gaps. So that's why you're hearing about double masking with the second mask sealing the first one. And frankly, whether it's cloth masks or whether it's a cloth mask over a surgical mask, those are incredibly good as long as we're getting everything sealed. Of course, if you can upgrade to a KN95 or an N95, that's better. But the others are incredibly effective as long as things are sealed well. And so we're very much encouraging all of our folks at Bryan to really get that second mask going wherever they can. Thank you.
Thanks, Russ. Good morning. I'll give a couple of updates on our hospitals here in Lincoln. St. Elizabeth and Nebraska Heart Hospitals both continue to be stretched thin, as we've talked about in previous press conferences. We remain on contingency care status, which means that several times, even every hour, we're assessing and adjusting to patients, staffing, and bed availability. This is nothing new, but particularly important right now in our hospitals. Like Russ talked about, every day we're looking at surgeries. Every day we're looking at surgeries and evaluating those needs based on the patients. Which ones are critical, delaying those cases that we can delay, and determining what surgeries we're able to move forward with. We've been doing that for many months, but again, right now, super important in our hospitals. Our patient loads, our staffing needs have grown exponentially over the past few months, particularly with Omicron. Across the region, CHI Health has 223 COVID-19 patients in our hospitals. 91% of those COVID patients that are on ventilators are unvaccinated. I want to say that again, 91% of our intubated COVID patients are unvaccinated. Omicron is significantly impacting our workforce. We have over 200 employees that are at home quarantining due to COVID-19. This puts tremendous strain and stress on an already stressed health system. We've entered what we consider a critical phase here in our Lincoln hospitals, and we need your help. Continue to need your help. If you haven't been vaccinated or boosted, please seriously consider doing so. Support our community in your hospitals by following the mask mandate that was reinstated last week. This is the right thing to do for Lincoln. Masking works, we know that. We've done very similar things at our hospital that Russ is talking about with upgrading masking and encouraging strong seals just to prevent the spread because it is such a virulent situation. So it works. We know that it works. It prevents spread. It slows the virus's ability to form new variants. We've been masking for the better part of 2 years now. We're all exhausted with the situation, but I would say it's never been more important to mask than it is right now in our community, given our numbers. So please consider your friends, your family, your neighbors, and mask up. Thank you.
Thank you, Russ and Derek, for being here today, and especially for your continued commitment to caring for the people in our community and the surrounding areas. As Derek just mentioned, and Russ, vaccination remains a primary tool for preventing severe illness and saving lives. According to December data from Nebraska Department of Health and Human Services, Nebraskans who boosted were 46 times less likely to be hospitalized for COVID-19. That's 46% less likely to be hospitalized. The chart shows hospitalizations in the state. The very slim green area along the bottom are people who are boosted. The slightly larger blue area are people who were fully vaccinated but not yet boosted. This group was 11 times less likely to be hospitalized for COVID-19. The data is clear. Vaccination helps keep people out of the hospital, and we continue to urge everyone who is eligible to get vaccinated and get your booster now. In November, December, and so far in January, over 19,000 people initiated vaccination in our community. 52% were in the 5 to 11 age group, and more than 30% were in the 18 to 49 age group. It's not too late. 65% of all Lancaster County residents are fully vaccinated, and 59% of our residents aged 12 and up have now received a booster or third dose. That's over 110,000 individuals. More than 1,600 of those receiving boosters or third doses are 12 to 15 years old, the most recent group eligible for a booster dose. 27% of children ages 5 through 11 are now fully vaccinated in our community. This week we're holding more walk-in vaccination clinics at local elementary school. This afternoon we'll be at Friedstrom Elementary from 3:15 to 6. Thursday from 4 to 6:30 we're hosting a clinic at Norwood Park Elementary. We continue to have clinics at the health department on weekdays, and we will also be at the Asian Community and Cultural Center on Friday from 11 to 1 p.m. You can find more clinic times and locations at our website, covid19.lincoln.ne.gov. All clinics offer first and second doses for 5 and up, booster Pfizer doses for 12 and older, and Moderna doses for 18 and older. The demand for testing remains high, so I'd like to provide a quick update on testing. Last Thursday, our health department opened a testing site at 1918 O Street in partnership with Total Wellness, and that site is running smoothly. Testing is by appointment only, and people can go to totalwellnesshealth.com/Lincoln to schedule. You can find other testing options at covid19.lincoln.ne.gov. In some instances, high testing demand can outpace capacity. We continue to work with our partners to do what we can to help residents get tested in a timely manner. And also, you may have heard that every household in the United States is eligible for 4 free at-home COVID-19 tests from the federal government. The website where you can order these tests is now live at covidtests.gov. Very simple to go online and order those. So whether you're getting tested at a testing site or taking a self-test at home, if you do test positive for COVID-19, you need to isolate. If you're exposed to someone who has COVID-19, you may need to quarantine. There are new isolation and quarantine resources posted on our website. These infographics help walk you through what you need to do and when. Another resource available is the COVID-19 dashboard. The dashboard is updated daily with key data on cases, hospitalizations, deaths, vaccinations, and testing. Data is a valuable tool that helps guide our COVID-19 response, and the dashboard is where you can track our local situation. Today, we're launching some enhancements to the dashboard, and joining us is Tommy George, one of our public health epidemiologists, to walk us through the latest updates.
Thank you, Director Lopez. Today I'll be reviewing updates to the City of Lincoln's dashboard application, providing information about the pandemic to the public. Overall, it looks different but maintains robust reporting with additional information. At the top of this summary page, you now see a navigation bar showing the sections in this application. Sections with multiple pages will have separate tabs for each page. I'll be reviewing key changes in each of these sections. First, I'll review the updated summary page seen now. At the top of the page are 4 important metrics: our vaccination percentage overall, our vaccination percentage for the people who are eligible 5 years and above, the total number of confirmed cases, and the total number of deaths due to COVID-19. We've also included 2 charts highlighting cases in the bottom left and hospitalizations in the bottom right. The chart you see now shows the 7-day total number of cases per 100,000 people residing in Lancaster County. The color scheme aligns with widely referenced categorizations of cases in low, moderate, substantial, and high levels. This is calculated by adding up the total number of cases in the 7 days leading up to a specific date, including that date, and dividing it by the total population size of Lancaster County. The chart you see now shows the total number of hospitalizations in Lancaster County attributed to COVID-19, including confirmed cases and persons under investigation or suspected cases. This includes both Lancaster County and non-Lancaster County residents. The vaccination section may appear familiar. It now includes the number of people boosted residing in Lancaster County, though. The new information included in this section are booster doses and a vaccination status by age group chart. You can see the number of people boosted now on the Overview tab of this vaccination section. Here is a tab within the vaccination section that shows the number of people receiving a booster dose by week and cumulative totals boosted by week as well. The Age Group Vaccination Status tab displays the vaccination status of age groups currently eligible for vaccinations. The pink bar shows the percentage of the population that has been fully vaccinated and received their booster dose, while the blue bar shows the percentage of the population that is fully vaccinated but has yet to receive their booster dose. The aqua-colored section at the upper portion of each column is the percentage of people in that age group that have received only 1 dose of the 2-dose vaccines, Pfizer or Moderna. This test turnaround time page is an additional tab within the testing section of the dashboard. We're now displaying the average turnaround time overall. This is the average number of days between when a person was tested and when their test results were reported to the health department. The new chart at the bottom of this page shows the labs that were reported the same day they were collected, 1 day, 2 days, 3 to 7 days, and over 1 week later. We've also made efforts to display the data for healthcare capacity in more detail. We now show the number of hospitalized people under investigation by county of residence in addition to the confirmed COVID-19 cases hospitalized. People included as COVID hospitalizations are people who have tested positive, meaning they've received a confirmation diagnostic test for the presence of the virus that causes COVID-19. Those who are suspected cases or PUIs, persons under investigation, are people who have been clinically diagnosed with COVID-19 but whose diagnostic test confirming the presence of the virus is pending. The ICU bed and vent availability tab highlights the percentage of ICU beds that are available and the number of confirmed cases by county of residence that are currently on a ventilator. That wraps up all of the additions to our COVID-19 dashboard. Please visit our website at covid19.lincoln.ne.gov and see the enhancements for yourself. We look forward to this tool being even more useful for the community. Finally, I would like to thank the Geographic Information Systems team at the City of Lincoln for their continued work on this dashboard. They've been excellent partners helping to stand up this updated application for the health department to more effectively communicate COVID-19 data with all of you. Thank you.
Tony, thank you, and I want to thank our entire epidemiology team, along with our city information services for this work on this. This robust local data enables us to better understand our local situation throughout the progression of the pandemic and be well informed as we make decisions to help protect the health of our community. And with that, I'd be happy to take any questions.
Just a question about that at-home testing. For people who are doing that, should they be reporting to the health department? Is that something that you're seeing or keeping track of?
You know, we do have a lot of people call us and let us know that they've been positive, and we provide guidance to them. But right now, there's not a mechanism to really collect that data and have it in the reporting system that the state does.
So with Channel 8, kind of talking about those at-home tests, they sure are hard to find right now. I know you said the federal government's obviously now you can order them. That's going to take some time though. Is the city doing anything, or is there anything you guys can do to bring more of these at-home COVID tests into Lincoln in the surrounding areas?
I think, you know, what we know from talking with retailers is that as soon as they come in, they're sold out. But I do know you can go online and order them. Somebody I was just talking to yesterday morning ordered 24 and should receive them this week. So that's something that people can look into. I haven't registered for the COVID.gov or covidtest.gov. But several people I know and at our department have registered just to see how easy it is. And the delivery is supposed to be in 5 to 7 days on those. I know that's not great, but I would encourage people to go ahead and start ordering them so that they have them on hand. And also I think with some of the enhanced testing locations that we have in Lincoln, Total Wellness is bringing up additional slots open. And I think sometimes people get a little confused. There are a lot of spots for antigen testing. So just if they look at PCR and think that's full, then go to the antigen testing and click on that. And you'll be able to get in and get an appointment. I know last night all the open spots were not filled, and they'll continue to increase as there's more community demand. We're also providing some assistance to Brian and some of our local medical clinics and having antigen tests available.
Pat, can you quickly explain the difference?
Well, the antigen is the rapid test. I'll just say it that way. Usually the results are in 15 to 20 minutes on most of them. The PCR is more definitive tests. We call it kind of the gold star, and in some places they require that. So right now we're asking employers and others not to require a PCR test. If you have a positive antigen test, you're positive. If you're symptomatic and you have a negative antigen test, that means you should have a PCR. And the materials for the PCR test are, as everyone can imagine, at very high demand. So we want to save those tests for people that really need them.
Pat, it's Ned Brenning with the Journal Star. Morning. I wanted to ask you, I know that nobody, wants to say or wants to think that Omicron is just a cold or anything, but I was just looking, your case numbers in the past 3 weeks, you said went up over
My check,
350%.
1, 2, 3, 4.
But
5,
I
6,
noticed
7,
that,
8. Let me check.
Sure.
So we can hear Matt.
Somebody was doing a mic check.
Okay, I think we're good.
So I was just saying that you said the case numbers had gone up over 350% the last 3 weeks, but I noticed the hospitalization numbers only went up about 20%. So that seems like an encouraging sign, I guess, that the bulk of those cases are not getting people seriously ill and requiring hospitalization.
What we're seeing is that our number has gone up, and we're holding, at one of our highest numbers. But you're right, Matt, that's one of the things that we are seeing with the Omicron, especially for those people who have been vaccinated and boosted. The symptoms aren't as severe. But even having said that, all the people that are having severe and very moderate infections, there's a great number of those, but they're not requiring hospitalization.
Okay. And then I want to ask real quickly about testing. I know that the NOMI Health site is by far the most used just because they seem to have the most appointments available. But they also have been closing down a lot lately because of weather. Has there been any discussion with them about possibly trying to find a spot that's, protected from the weather so they can stay open? Have you had any discussions like that?
Actually, Matt, I have quite a few discussions with NAMI, sometimes 2 or 3 a day. But I just, again, reached out to them right before I came down here to find out what their plan is to address this so that they can remain open and be available to our community. That's at least probably 500 to 900 tests a day that we're not able to offer. So it's really important for them to try and find a solution. And we've worked with them as well. I'm not sure that, I don't know. I haven't checked all the weather situation in Utah, but apparently not understanding what Nebraska winters are like when we can be 62 one day and, 20 the next has been a problem.
Hey, Pat, also with Channel 8 here again. We're hearing a lot, whether it be on social media or to our email, about people saying they're just kind of giving up on getting tested because of how hard it is to find an appointment or get, even finding a test and how long the wait is. For an example, by the time they get a positive, they pass.
Check 1 2 1 2. Check.
What do you have to say to someone that says that they're, because of that reason, they're over testing?
Alexa, you were cut out by somebody doing a mic check, so I only got part of what you were saying.
I'll say it one more time. So some people we're starting to hear that they're saying they're kind of just giving up on getting a COVID test because of how hard it is to, whether it's find them at the store, whether it's to set up an appointment, things like that. So for example, by the time they do finally get a COVID test and they get their positive results back, they're already past that 5-day or so isolation period. What, as the health department, what do you guys say as far as people that are just kind of like saying, I'm not going to get tested, or, do you recommend people still get tested, or what do you have to say to people that are having those problems?
We are recommending people get tested, and we're working to bring, as we did, standing up Total Wellness last Thursday, to bring other locations in. I know that Brian is doing things with their urgent care. You can see what they have available. I think we just need a little patience, but definitely what people need to do is really, if you are having symptoms, please isolate. And a test at least tells you if you've had COVID, and so that you can tell those, your loved ones around you or those that you've been in contact with, so that they can quarantine and take appropriate measures and not continue to spread the virus in the community. And I think, we're continuing, Alexa, to work on other testing options that can be available in the community. And hopefully in the next 10 days, we'll have additional information. But 10 days seems like a long time to me. That's why we're really working with Total Wellness and NAMI to get those sites to increase capacity.
Hey, Pat, this is Matt from the Journal Star. I had another quick question for you. So UNL has started their reentry testing in the past week and a half or so, and I noticed that in the past 14 days, they've had almost 1,900 cases from that. I'm assuming that those are part of the cases that you're reporting every day for the county. Is that correct?
No, we count those. We include them in the final number, but those are, our case counts are actual cases that are in, we count the university as part of our community, but we have a separate count for them versus just our community.
So like the 4,400 and whatever cases it was last week wouldn't have included the cases from UNL?
No. And UNL is continuing the testing. Matt, I'm glad you brought that up because the university really has been a tremendous partner and provided great leadership in being able to offer PCR testing to their student, faculty, and staff. And the other part of that is that they're also working with some of the other colleges here and providing testing for those on their campuses. So we have a very good method of identifying cases and isolating and quarantining. UNL is going to implement their second stage of testing next week. Then we'll reevaluate where we are based on the number of positives. So just to give you a little insight to that situation.
Okay, and then I just have a follow-up question. In terms of testing, positivity rate, case numbers, all those indicators, are you seeing any evidence at this point of any leveling off or anything like that, or does it appear that we're still increasing case numbers?
We're still increasing cases right now. We're not leveling. We're hoping that we might see that in the next couple of weeks. We lag behind, the East Coast, so that's what our hope is, Matt, that in the next couple of weeks we'll start seeing that. And we're watching our flu numbers really closely, too.
Thanks.
Okay, thanks again for joining us today. Be sure to get your vaccination and wear your mask.